In the past, we've talked about the CDC requirements for opening the pool. We've also sent information out to the people regarding robocalls. In this information, this is the New Jersey Department of Health requirements for community pools. We, the Board of Trustees, must hire adequate staff and implement protocols for staff training and pool operations. As trustees, we must train and equip all staff on COVID-19 awareness, cleaning, and sanitizing procedures. We must hire a pool ambassador to monitor and encourage social distancing of bathers on the pool deck. We must document COVID-19 awareness training and risk reduction strategies for all personnel. We have to implement a policy for screening staff entering the facility, which includes screening for fever or signs of COVID-19 illness prior to being admitted to the facility. The pool facilities must post signage that patrons should be on the alert for signs of illness and stay home when they have symptoms of COVID-19. We must maintain a sign-in sheet for all staff and patrons. We must establish procedures for safely isolating and transporting anyone showing signs of symptoms of COVID-19. We have to provide sanitizer stations throughout the pool facility. We must sanitize after each person uses the following items: the entry gates into the pool area, pool hand railings into the pool ladders, all lounge chairs, all deck chairs, all tabletops, all door handles leading into the clubhouse, all door handles exiting the clubhouse, toilet flush handles, paper towel handles, all faucets in the restrooms, door handles leading into the restrooms, door handles leaving the restrooms, door handles leading into the stalls, and door handles exiting the stalls, and the exit gates leading from the pool area. These items have to be sanitized after each person uses them. So as you can see, we would require a number of people to monitor and sanitize all of these items. That will be discussed in just a bit. We must encourage 6-foot social distancing while people are in the water or on the pool deck. We must separate all benches and tables with at least 6-foot spacing. We must post signage indicating restrictions, expectations, social distancing, hygiene, and indicating that face coverings are strongly encouraged. Face coverings should not be worn in the water. Hands should be washed frequently with soap and water. Hand sanitizer should be used if soap and water are not available. Signs that indicate do not touch your face, especially your eyes, nose, or mouth, with unwashed hands. Signs that indicate stay home if you are sick, and reminding people to practice social distancing and avoid large gatherings. Now, that's a considerable list here that's required by the New Jersey Department of Health. But what would this mean for us? Well, the pool is open 7 hours per day, 7 days a week. That's 49 hours per week. So we couldn't just hire, let's say, if we decide that we need 5 people for this, and I'll show you why we need that many, we can't just hire 5 people because then we'd have to pay overtime pay. So in reality, we'd have to hire 10 people, and each one would work 24 and a half hours per week. Now, hiring 10 people, 10 responsible individuals, will take a substantial amount of resources just to hire these people. but they have to be responsible. So the hourly wage that we'd be paying these people would be roughly $14 per hour. The number of people that we would require would be 5 people on duty at all times. We would have 1 at each entrance taking temperatures and signing people in. We would have 1 to disinfect the clubhouse doors. We would have 1 to disinfect the bathrooms. And we would need 1 to monitor people's social distancing. Now, we could cut that back to 4 if we only have 1 entrance into the pool, but that's something for discussion. The cost per day for these 5 people on duty would be, just for their hourly wage, would be $490 per day. $490 per day. Now, these people would have to pay withholding tax, and we would have to commit to their withholding tax also. 6.2% for their Social Security, and other withholding that we would have to do amounts to about a 9% amount that we would have to commit on top of their salary. That works out to $44.10. So the total cost per day for these 5 individuals is $534.10. Now, there are 20 days approximately in July that we would have to pay these people for. There are 30, and that 20 days in July would amount to $10,600 in employee expenses. There are 31 days in August. This would amount to $16,557 in employee expenses. And roughly 10 days in September, that's $5,341 in employee expenses. The total for employee expenses over this time period would be $32,580. Now, the New Jersey Department of Health requires a number of items. Number 1, it states that everyone should wear a mask. And on that basis, we would have to supply masks, because many people will come to the pool having no idea that they need to wear a mask, and they may not even have masks if they social distance in a serious manner at home. So we would have to supply everyone with masks and other things. Some of these other things that we would have to supply, in addition to masks: gloves, disposable disinfectant wipes, hand sanitizer, spray bottles, recording journals, writing supplies, tape, and other things. I estimate the cost for these items to be about $2,000. We would have to set up 4 sanitizing stations. On Amazon, a sanitizing station is available for $130 each. With 4 sanitizing stations, that amounts to $520. And staff trainings. I have no idea where we might get information on staff trainings, but it would likely cost in the area of $1,500. Now, we would also need 2 thermometers. These are no-touch thermometers. They're available on Amazon at $80 each. That's $160. Our people must do the following. Chairs and tables must be arranged with 6-foot spacing. We have to put tape on the ground to note spacing requirements. And on average, this would require 170 square feet per person or chair. People must be social distance in the pool and on the deck. Normally in the pool, people will gather in groups of 3 or 4 and then just chat together. That would not be possible according to the New Jersey Department of Health information. People in the pool have to social distance at 6-foot intervals. If people do not social distance as per these requirements, our lawyer recommends that we call the police and if people refuse to social distance. Now, we have about half the season remaining, and normally a season of pool costs are about $26,000 to $28,000, as I recall. So as we have half of the season remaining, Our lifeguards and pool supplies and running the filter would be about $14,000. If you add in this amount to all the other amounts that we discussed previously, that comes out to a total of $50,760 just for half the season of the pool. This is about $25,000 short of what we budget for normal pool expenses. I don't think we have an additional $25,000 hanging around just to commit to additional pool supplies. Now, roughly, in the sheltered areas of our pool facilities under the tarps, we can fit social distanced at 6 feet, about 15 people under each tarp. That's 30 people. We have 2 tarps. In addition, in the shallow end of the pool, if people are social distanced, we can fit about 20 people in the shallow end of the pool. So that's a total of 50 people total would be our maximum number of people that we can allow in the pool at any one time. So we have to have someone who is going to monitor the number of people and tell these people, I'm sorry, we have reached our maximum capacity. You cannot come into the pool today. That's going to be a problem, and I don't know who's going to take on that responsibility. In addition, we have to have someone who, if someone shows with symptoms of the disease, someone from our facility has to take that person home, transport them home, and make sure they get assistance. I don't know about you folks, but if someone is showing symptoms of COVID-19, I do not want to get into a car with them at all, and I certainly don't want to escort them home. So maybe some of you folks are braver than I am, but that's not something I would want to do. So there you have the presentation for what is required by the New Jersey Department of Health. It would cost us an immense amount of money that we really don't have available for this, and it would put a lot of requirements on us that we are just not equipped to supply. This concludes the presentation for the New Jersey Department of Health requirements.